Hello, my name is Ignacio Hidalgo. I'm going to present you the work title A Mobile Application for Hypoglycemia and Hyperglycemia Prediction by Genetic Program. This work has been developed in collaboration with the University Hospital of Toledo in Spain and the University Complutense of Madrid. Complutense University of Madrid. In this work, we introduce a mobile application for insulin dose calculation support. That includes a system for generating alarms for hypoglycemia and hyperglycemia situation that can be useful for people with diabetes. The models are generated using different techniques of the genetic programming variant known as grammatical evolution, and has the advantage of being interpretable and evaluatable by the medical staff. The outline of my presentation is this. First, I will give you an introduction to diabetes mellitus and the problem of prediction. Then we will review some of the other application for diabetes management in the market. Then I will explain how we are going to predict in the hypoglycemia and hyperglycemia, explaining the techniques and the methodology. Then I will give you some results, preliminary results, and I will conclude the paper, the presentation, with the conclusions of the work. So diabetes is a group of diseases characterized by high level of blood glucose levels, resulting from defects in the ability of the body to produce or use the insulin, which is the hormone necessary to process the glucose and the carbohydrates and convert this in energy for the body. There are more than 400 million people suffering from diabetes all around the world, and there are two main types of diabetes. Type 1 diabetes mellitus, that is produced because of the destruction of the insulin producing cells in the pancreas, and type 2, which is produced by a resistance to the insulin by the cells of the body. The pancreas is producing insulin, but the insulin is not working properly due to some problems, resistance to it. It's important for people with diabetes to have a control of the blood glucose level in order to avoid not only long-term complications such as retinopathy or heart problems, but also certain complications that appear especially when we have extreme values in the blood glucose. So usually a measure of the quality of the control of the glucose is the time in range. That is the time that the person with diabetes has levels in the healthy range, which is usually between 70 and 180 milligrams per deciliter. Nowadays, this level is even smaller, and usually now the time in range is considered only for the range between 70 and 140 milligrams per deciliter. But time in range is the most used variable or parameter used to know the control of the illness by the people with diabetes, by people with diabetes. And as I told you, what is important is to avoid both high levels and low levels of hyperglycemia and hypoglycemia in their extreme values. The importance of hyperglycemia and hypoglycemia prediction, this is a mistake, is that the effective blood glucose management is crucial for the people to avoid acute complications. Predicting extreme values in time is of vital importance to solve short-term complications, and people with diabetes are particularly concerned about suffering a hypoglycemia, and moreover the event will be prolonged in time because they can lose the conscience and eventually to die. It is crucial to predict also hyperglycemia because may cause health damages in the short term and potential permanent damages. So the motivation of the work is to obtain wide both reliable predictive models of low blood glucose level and also high blood glucose levels for people with diabetes using glucose values and other variables easily accessible from smartwatch data. And moreover, we want to include this in a mobile application that can help people with diabetes to manage those situations. At the end, we are going to produce a set of if-then-else conditions that evaluate the values of the variables during the last 2 hours before the prediction, and with this condition generate a signal. In other words, what we are going to do is to solve a problem of classification by grammatical evolution. There are other applications for diabetes management in the literature or in the market. Clinio, for instance, provides a personalized meal plan, a shopping list, and some exercise routines, and comprehensive activity logs. Also track the caloric intake and other blood glucose levels and so on. However, it's not exclusively designed for diabetes management, so it's not specifically for people with diabetes. OneDrop, for instance, is notable for its extensive feature set. It caters to individuals with type 1 diabetes, also for type 2 and pre-diabetes, and integrates various apps and devices, and it comes with a relatively higher monthly cost than other alternatives. The One Touch or Reveal app is compatible with glucose meters, but the number of functionalities is not too much. There are other applications such as Diabetes Connect, MyFitnessPal, or Carb Manager, and so on. And our application is Glue Model. It's an application designed to assist managing diabetes, and it offers a suite of artificial intelligence tools and statistical techniques for predicting glucose levels and to aid in decision making. The functionalities of Glue Model are the main functionalities are automatic recording of biometric data using smartwatches and connecting through Apple Health, a smart insulin bolus calculator, the generation of prediction models for glucose using different techniques, a smart estimation of optimal hypoglycemia threshold, a smart calculation of the sensitivity to insulin, recording of bolus recommendation and glucose prediction. It can also test standard models of neural networks directly implemented in the mobile phone. And what is more important for this work is the generated prediction model for hypoglycemia and hyperglycemia, and with this generate alerts. Here we can see the implementation in the application of this hypoglycemia and hyperglycemia screens, where we can configure new alarms and we can generate new models. The application is now in Spanish and we are translated to English. So finally we solved the problem of prediction by a binary classification. We use the glucose values of 2 hours before the prediction time. We also use the variables of the heart rate, the number of steps, and the calories burned. With this, we generate an output, which is the class of the prediction of the time horizon considered. That is the value of the glucose at the time horizon of from 15 to 60 minutes will transform it into a class. And this class is determined by the limit set by the user and the glycemic state. We can generate an alarm for different limits. So finally, if the glucose is lower than the hypoglycemia limit, we say that we are going to have a prediction of positive hypoglycemia prediction, and the same with the hyperglycemia. We use dynamic structural grammatical evolution, and we use weighted accuracy as a fitness function. The weighted accuracy is a measure of the accuracy and the F1 measure, and the F1 measure is obtaining using the recall and the precision. Being the recall, the true positives divided by the true positive plus false negatives, and the precision, the true positive divided by the true positive plus false positive, that usually is used in other machine learning problems. We use this grammar for the classification. You can see that we generate we search for a binary expression with depends, in this case is for hypoglycemia, and we include here the variables that we are going to use in the dataset. One important thing here in the grammar is that we can use the grammar for doing the feature selection. For instance, if we don't want to use the glucose of the previous 15 minutes, we only need to delete this from the grammar. But also we can let the grammar to search for good solutions and to do an implicit feature selection, just because the good solution will include the most important variables, and with the feature selection is done automatically. We use data from 15 patients from the hospital, and here we can see the experimental results for those patients. We can see that we compare grammatical evolution and dynamic structural grammatical evolution with better results in dynamic structural grammatical evolution. Here we use customized problems. So the results for this is that for each patient we shown previously the best model from 30 execution for a 60-minute time horizon. The differences between both algorithms are small, and the average results gone from 85% to 95%, and some patients obtain better results than others, which is expectable since we are using customized models. But one of the important things is we can obtain lower models for some of the patients that has some special patterns that are can be obtained with the grammatical evolution. As a conclusion, we presented here a mobile application alarm system that predicts customized hyperglycemia and hypoglycemia events. We obtain rule-based models that can be interpreted by the medical staff, and we have some limitation. The application must be tested by different users for longer periods, and the alarm system should be tested also with at least 2 weeks of data. This work has been supported by the Spanish Minister of Science and Innovation and University under those grants. And thank you for the participants from the hospital, also University Hospital of Toledo and University Hospital of Alcalá de Henares, both in Spain. Thank you.